This presentation will be given to families with newly diagnosed children with type 1 diabetes. They will have received their initial diabetes education in the hospital, but they will return to the clinic within a week or two for follow-up and additional education. We don't know exactly what causes type 1 diabetes. As far as research can tell, it is a combination of a genetic susceptibility and some kind of exposure to a virus, a toxin in the air, water, or food that damages the pancreas. This presentation will add to the knowledge you gain in the hospital and provide new information. Remember, we discuss the complications of diabetes so your child can avoid them with good glycemic control. Almost all of the complications are preventable. Although diabetes can present at any age, the most common age for diagnosis is 5 to 6 and 11 to 13 years. Caucasians are at a higher risk than ethnic minorities, and boys and girls are equally affected. We do see a higher incidence of onset in the winter months compared to the rest of the year. This supports the environmental exposure theory, as viruses and illness are more prevalent during these months. As parents of a child that is newly diagnosed with diabetes, I'm sure you can identify with at least a few of these feelings. It can be overwhelming at first, when it feels like diabetes has taken over your whole life and the burden of keeping your child healthy seems so heavy. But you are already on your way to the new normal that will be your everyday life. You will become the expert on your child's diabetes, and in turn, you will pass that knowledge on to them, so that they will become young adults who will successfully manage their disorder while leading the normal life you want for them. The basics of diabetes treatment are healthy food, blood sugar checks, administration of insulin, and exercise. Highs are treated with insulin, lows are treated with carbs. Once your child is stabilized, you have the option of using an insulin pump. We offer an introduction to pump class to answer your questions when the time is right, and will guide you through the process if you decide to go forward. We will test your child's A1C blood level at every office visit, about every 3 months. This test is a measurement of the average blood sugar over the previous 3 months. Red blood cells and glucose molecules are both rather sticky, and so the glucose bonds to the outside of the red blood cell. The red blood cells have a lifespan of about 3 months, so at any one time there are old cells covered in glucose and newer cells with only a few stuck to them. The test is an average of the percentage of glucose on the cells, or glycated hemoglobin. It is a reflection of your child's glycemic control. Your goal is 8 or less. In this slide, you can see what A1C level is associated with an average blood sugar level. Balancing a normal blood sugar while trying to avoid hyperglycemia for high blood sugar and hypoglycemia, low blood sugar, is the focus of good diabetes management. Over time, you and your child will become experts at how exercise, specific foods, illness, and stress affect your blood sugar. Children will notice how they feel when they are low or high and be able to let you know, or eventually to treat it themselves. During the honeymoon period, which can last from weeks to months to a year, the pancreas will rally, and with the few beta cells it has left, will produce a little insulin. You will notice that you have to adjust insulin by lowering doses to keep from going low. Unfortunately, this does not mean that the diabetes is gone. Eventually, those remaining beta cells will disappear. Your child will always need insulin. Exercise is one of the best ways for kids to maintain good health. It may take a little practice and experience for your child to figure out how to balance his or her blood sugar with being active. Always have them check their blood sugar before the beginning of strenuous activity. We would like them to be at least 100. Start with a 15-gram snack and then plan on a 15-gram snack for every hour of activity. If you're joining a team, be sure and let your coach know that you have diabetes and what your needs are. This is a hard slide for parents. All the complications that have plagued people with diabetes in the past. Fortunately, with today's improved treatments and good metabolic control, they can be just a memory and not a reality for your child. We will do a quick review of the body symptoms, pointing out the complications that diabetes can have on them. You need to understand the effect diabetes can have on the body, but it doesn't mean your child will ever experience them. The cardiovascular system can be impacted by high blood pressure, which can lead to macrovascular complications such as atherosclerosis, stroke, and peripheral vascular disease, and microvascular problems with vision, retinopathy, the kidneys, nephropathy, and the nerves, neuropathy. The respiratory system is mostly impacted by the possibility of a weakened immune system, increasing the chance of recurrent respiratory infections. In the gastrointestinal system, diabetes may cause delayed stomach emptying, which means the possibility of a low blood sugar an hour or two after eating because the body hasn't processed enough carbs to equal the insulin ratio given. Celiac disease is an autoimmune disorder that damages the lining of the small intestine when gluten, found in wheat, is consumed. Children with diabetes are at increased risk for celiac disease, and we will be screening for it annually. Kidney disease in the urinary system is a result of damaged blood vessels that allow protein to leak into the urine. Over many years, this microalbuminuria can lead to high blood pressure and high levels of waste products in the blood. That is the point where people with diabetes need dialysis. When sticky glucose molecules clog up the tiny capillaries in organs throughout the body, they are damaged. This leads to the eye problems and numbness, tingling, and loss of sensation in hands and feet, known as neuropathy. Good foot care is a must when your child becomes an adult. Diabetic ketoacidosis is a serious complication that will be discussed separately. Remember, these are the ghosts of diabetes past and do not need to be something that is part of your child's future as long as they maintain good metabolic control. Some newly diagnosed children present initially with diabetic ketoacidosis, or DKA. When the body has no glucose to use as fuel due to the absence of insulin from the pancreas, it starts to burn fat. Ketones are the byproduct of this process and end up in the urine. This is a very serious condition, as the pH in the blood becomes acidic and the other body systems can only compensate temporarily. As the hyperglycemia increases, so does your risk of DKA. It is very important to check for ketones whenever your child is ill or has a blood glucose over 300. The treatment for ketones is rest, water, and insulin. Call our office if they are greater than trace, and we will walk you through the treatment protocol until you are comfortable on your own. Your child will be seen in the clinic about every 3 months. This visit will include a physical exam, a download of the glucose meter, review of treatment regimen, and an A1C test. We will review glycemic variations, insulin to carb ratios, and coverage of high and low blood sugars. Once a year, we will do lab work and want them to have their eyes checked by an ophthalmologist and see a dentist. There may be additional tests needed or added as your child ages. There are many factors involved in both the development and treatment of type 1 diabetes. Environmental and genetic factors both are involved in the onset of the disease, and along with behavior and lifestyle choices, affect the eventual risk of complications. Nothing you or your child did caused them to get diabetes. You couldn't have stopped it or prevented it from happening. But now that it is a reality in your child's life, there are things you can do to control it and decrease its impact on your child's healthy life. Modifiable risks are something within your power to change. For diabetes, these include diet, nutrition, exercise, education, weight control, metabolic control, and sticking to the insulin and treatment regimen, and avoiding toxins in food, air, and water whenever possible. Non-modifiable risks are just facts of life you can't change that increase the risk of developing diabetes. These include a genetic predisposition, family history of type 1 diabetes or other autoimmune disorders, and race. Those are just the luck of the draw. Insulin was discovered less than 100 years ago, and look at the amazing advances that have happened in just the last few decades. Technology and research are rapidly changing the face of diabetes. New pumps and continuous glucose monitors, inhaled insulin, islet cell and stem cell transplants, and artificial pancreases are already being used or will be available in the near future, maybe even a cure. One thing is already a certainty. Your child's future still holds all the dreams it did before. There may be more work to get there, but it will be worth it.